Welcome to part 2 of my educational video about long COVID. And in this video, I want to talk about some of the breathing exercises that you can really have in your tool belt if you're working with someone with long COVID. And these are exercises that are in the oxygen advantage, and some of them are in the breathing cure. But there's a couple of things that we do know about long COVID. The first one is that people with long COVID have an increased sensitivity to carbon dioxide. They are very sensitive to air hunger. We have all felt the feeling of suffocation during our relapses and with the issues with our respiratory system. So that's one thing to keep in mind. Number 2 is our autonomic nervous system is affected. So we really need to balance that with breath work. Number 3 is our vagus nerve. One of the theories of long COVID is actually the vagus nerve is damaged by long COVID. Certainly our vagal tone has diminished. So focus on breathing exercises that can increase vagal tone. Number 3, I think, is that our diaphragm is actually affected. It's one of the major organs affected by long COVID. So certainly that's your big breathing muscle. A lot of us with long COVID have been disabled. We have certainly stopped exercising. We've become very, we don't move. We've become immobile. And when you don't use a muscle, it diminishes in strength. Hence, the diaphragm is affected. The other thing is that people with long COVID are very in tune with their SpO2 percentage. We are told as long COVID sufferers that if our oxygen saturation goes below 90, we are to seek medical attention. So everyone who has long COVID has a pulse oximeter, and they monitor that. So it's very important to be aware of that if you're doing some air hunger exercises or you're doing some of the stressor exercises, because I remember the first time I did one and my SpO2 dropped to 80 something, and that almost caused a panic attack for me. So be very aware of that. Now, the next thing that I want to make you aware of is that every person with long COVID has very, very different symptoms. And for that reason, I would really recommend working with people on an individualized basis, because we are all suffering from sort of long COVID terror. And we feel like we're not in control of many things. And these breathing exercises that you do with your clients can give them some normality or give them a little bit of control in their life. So working with someone individually is one of the things. You're really reaching out, you're holding their hand, you're watching them, you're adjusting them. This is not by any means a cookie cutter program that you would just give to everyone with long COVID, as I think you're understanding. The other thing that I have stressed over and over again is the pacing. And a lot of people with long COVID were endurance athletes before, and we're used to pushing ourselves, and we're used to graded programs. Those are the programs when you add into every kind of different workout. You add a weight, or you add time, or you add frequency, or you add intensity. That is not the case with long COVID breathing exercises. You need to go so slowly. And as Patrick has mentioned, when you finish a breathing session with someone with long COVID, they need to be able to recognize that they could do that whole session again. So that's number one. Number two is progress. And I think the breathing exercises for a normal individual will show progress. That is not the case with people with long COVID. It is this 2-step forward, 1 step back, 2 steps forward, 1 step back. That is part of long COVID. So we would get discouraged as people who suffer from that. If you're aware of it, you can be more cognizant, and you can talk to your clients about it. This is not a race. You know, we've been slogging this out for a long time. We don't need results immediately. And here's just an example. I started doing breath work and monitoring my BOLT score back in April. And when I first started, my BOLT score was 6. So I've been doing it for 9 months. Now my BOLT score is now 16. And I do my breathing exercises every single day. So you can see that there is progress, but it is nowhere near where I would want it to be, or where I would expect it to be, doing the amount of training that I'm doing with my breath exercises. So that's a little bit of background on what you need to look for and how you need to adjust your exercises to fit your client. Remember, they're very scared. We have all suffered from feeling suffocated. We've all had episodes of hyperventilation. When you go into a relapse, you panic, you get anxiety. I know I had so much hyperventilation because I had no idea what was going on. So keep that in mind. We are scared clients. So number one, let's think of some really positive things that we can do to help these people. And number one is teaching them nasal breathing. That is the most important thing. We're over breathers, and just teaching your clients how to breathe through their nose is so important. Talking about the benefits of nitric oxide, and don't overwhelm them, but just give them a couple of pearls, because we all know what nitric oxide is, because that's something that has been researched with long COVID. So that's number one. Number two is the BOLT score. Remember, there is not going to be this increase that is, I can't even think of the word. It's like a ski slope going up. All right, it's going to be up and down. And don't let your client get hung up on that BOLT score. I always tell my clients, do their BOLT score first thing in the morning and do it at the same time every single day. And here's another thing. When every now and again, your BOLT score will go down. And that is not necessarily a cause for concern. You don't want to get a phone call from someone with long COVID saying, my BOLT score's gone to half of what it was. Am I going to relapse? That's not an indication of a relapse. It's just an indication of something else is going on. The other thing, our sleep is really interrupted. And it's mostly interrupted because we have become sedentary. We can't move. We're fatigued most of the time. And we're either sleeping all the time or we're immobile all the time. There are some days when I had long COVID, I was sleeping 22 hours a day. I wouldn't even get out of bed. And the only thing I would do is maybe get up, make it to the shower and back. That's how sedentary you become. There are some days I manage 200 steps in a day. So when you're not moving your body, sleeping at night is often very difficult. So teaching your clients about the importance of just trying to rest at night. And introducing taping of the mouth very slowly. I certainly talk to my clients about taping during the day before they start taping at night. Once again, that terror of suffocation is very real for long COVID people. So have them tape during the day when they feel comfortable, have them tape at night. The other thing that because our Bolt score is so low, our respiratory rate really increases at night. I know my husband on many occasions listens to me breathing at night and my respiratory rate will increase. Now, that's not a cause for concern. It is something because our Bolt score is so low. So it's something that we work on. But getting your clients to tape at night is a goal. And the other thing is the panic and the anxiety. And I can't tell you how scary it is to have a long COVID relapse. So when you're working with a client, you need to make sure that they communicate what you're doing with them to a partner. Because when we get into panic, when we have a relapse, we panic. And all bets are off. You start hyperventilating, you start upper chest breathing. So sharing this information with someone, long COVID people don't get left alone. And so sharing it with someone that can coach them through these panic attacks and the anxiety that we feel is really important. So sharing the importance of the nasal breathing, the exercise number one. And that is the backbone of long COVID breathing. Teaching your client exercise number one, knowing that the breath hold part is half of their Bolt score. So for me, when I first started, my Bolt score was 6 seconds and I could breath hold for 3. And then I would recover for 15 seconds and breath hold for 3. And recover for 15 seconds. Now, that is one of the best exercises, especially when things start going wrong for someone with long COVID. So to say, as soon as you start feeling anxious, as soon as you start having heart palpitations, start your small breath holds. So that's number one. And the other thing about exercise number one is making sure if they're monitoring their heart rate, that after they've done a session of that breathing, that their heart rate returns to normal. Because if their heart rate is going up, it means that they're causing their body too much stress. So that is something, emotional, physical, chemical stress for someone with long COVID causes relapses. So that's something to keep in mind. Now, exercise number 2 is very, very difficult for people with long COVID. I struggle doing exercise 2A. One of the best ways to teach it is to have your client lying on the ground on their backs. For some reason, that helps just feeling the air hunger. And the other thing about people with long COVID is often when we're sitting up, our heart rate starts bouncing around. So having someone lying down is often the best way to teach 2A, 2B, and 2C. So lay them on the ground and talk them through those exercises. But as I said, exercise 2A is very, very difficult because it does cause air hunger. We're already sensitive to CO2. So you just take it slowly. So even if you can half the amount of air, not half, but double the amount of air going in your nose and out of your nose, that's a good start. I would say the diaphragmatic breathing with your hands either side of your rib cage, your lower rib cage, is very good. The paced breathing is also something that needs to be changed for people with long COVID. I know personally, I cannot do a 4 and a 6. So I started at a 2 and a 4. And I was able to maintain that. Remember, when you've got that slightly longer exhale, you are going to increase the parasympathetic nervous system. So even a 2 and a 4 would help somebody. And then you could increase it to 3 and 5. And then when you progress slowly, you can then go to 4 and 6, but don't jump right into 4 and 6. That is something that a lot of breathing programs that try to teach long COVID breathing do. They expect you to start there. If you've got a BOLT score of less than 6, in fact, if you've got a BOLT score less than 10, you will not be able to do 4 and 6. You will start getting into trouble. And like I said, we do not like feeling that air hunger and the panic of not being able to complete things or not being in control. Always teach cadence breathing before you progress to box breathing with people with long COVID. So like I said, that cadence breathing is also a good one to do prior to bed, just to quieten them down. All right, exercise number 3. I wouldn't recommend it. Most people who have got long COVID are not exercising. Walking is very difficult because of the POTS that we have, and also because of the inactivity. And, some of us have got really serious heart issues from long COVID. So hold off on exercise number 3. Finger underneath the nose is very good. And the other one that is also very good is the cupping. And I know that Patrick talks about the cupping being almost like we're trying to get that hyperventilation. But if you're in a state of panic, it can also help that you're just getting some air in, but you're controlling the air. So that's another one that you can do with your clients. Also, we've done a few exercises where we've blocked one nostril. So when you leave your left nostril open, that actually helps increase the parasympathetic nervous system. So that is a very good one for people with long COVID that can breathe through their nose. So just blocking your right nostril and just doing some easy breaths in and out of your left nostril to increase your parasympathetic nervous system. We are in overdrive. We are in fight or flight most of the day. That's the way our body is. We don't feel like we are, but a lot of the, if you're getting feedback from like a Whoop or an Aura Ring or some of the other things that people monitor themselves, you will see that you are in the sympathetic nervous state. So that is something to be aware of, trying to just calm the body. Now, I'm just going to finish talking about clients that are coming to you that were athletes prior to long COVID. Maybe they're at the end of long COVID and they want to get back into an exercise program. And the first thing that I would talk to them about is there's two types. There's two types. There's before COVID and there's post-COVID. So our egos as athletes remember what we could do prior to getting COVID and long COVID. We have to let that go. We're all starting again from ground zero. So once again, if you've got an athlete, the most important thing you're teaching them is that nasal breathing, because that is actually going to help their performance when they come back into their exercise routine. The other thing is monitoring their heart rate. So if your client is an avid athlete, you need to stress to them that unless they can complete their whole workout nasal breathing, that's the exercise intensity that they should be following. So nasal breathing 100% of the time for people with long COVID. Walking is very difficult because you're upright, you're using a lot of your big muscles. Swimming, because you're in a supine position or prone, is often a lot easier for people with long COVID. Rowing on a rowing machine is easier. And sometimes people on a trainer do well. But even if you're doing strength work, you need to make sure that your client is breathing 100% through their nose. If they start having to mouth breathe, they're working out too hard. The other thing is monitoring their heart rate. And our heart rate variability has been it's been decreased by long COVID. So you really want to watch your heart rate variability, and that is a very individual number. So my heart rate variability belongs to me and nobody else, and I compare that with my heart rate variability. So if I see that my heart rate variability has decreased 40%, even if my heart rate decreases 20%, I do not exercise. It means that I need to recover more. And then the last thing I want to talk about is your heart rate. So we all monitor our heart rates with different devices. And if you are recovering from long COVID, one of the things that I stress with my clients is using the heart rate zones. So Phil Maffetone came up with a slightly different calculation. It is 180 minus your age. So if you're 50 years old, that is 130. And then because you're coming back from an injury, you need to take 5 off that. So if you've got a client who's going to go out for a walk and they're nasal breathing, you need to make sure that their heart rate does not go above 125. Okay, so that's really important because we tend to push ourselves too much and we are recovering from a huge injury. Anyway, that's a long video. But thank you for watching. If you've made it to the end, thank you for joining me. I'm always here to answer questions, but I did want to give you a little bit of a background on some of the experiences I've had with long COVID breathing. Like I said, just take it slowly, be sympathetic with the client and try to work with them. Like I said, increase the frequency, but decrease the duration. We are very, very fragile people. And, just like I said, pace them and take it easy and don't expect massive results. Thank you for watching.